Doug, please describe the evolution of the stimulus program and meaningful use.
So the Meaningful Use Program was set up in 2009 as part of high tech and a law that was passed within the United States. It really had three stages. The first stage was about adopting electronic health records. The second stage was about getting people to exchange information using standards. And then the third was really about trying to make sure that people were using that information in a useful way. Right now, we're through that first stage of adoption. And we've seen the adoption of electronic health records move from approximately 17% in 2008, 2009 to well over 66% in the United States. Among academic medical centers, we've actually seen an even greater increase. We're well into the 90% around academic medical institutions and larger healthcare plans. So we are now entering our second phase, which is about exchange. And I think we will have a lot more to say in the course of the next couple of years to see how that is progressing with regard to meaningful use.
So what is the role electronic medical records play in the current discussion about quality and reimbursement?
Well, I think electronic health records are fundamental to making sure that we've got high quality care. It's very challenging to be able to measure the quality of care if you've got patient records, because you really have to go in and read those records, abstract that information, and be able to determine what's there. Electronic health records allow you to really measure those things that matter: laboratory test results, the number of visits, whether or not someone gets readmitted to the hospital. Those are all important quality measures, and I think the electronic health record really accelerates our ability to measure not only traditional quality measures, but other things that may be relevant to a patient's care.
Please describe the role of Tacori and the Pico Trust Fund.
So I'm glad you mentioned the Pico Trust Fund and Tacori. That actually is part of the Affordable Care Act, which was passed a few years after the High-Tech Act and Meaningful Use. It really is about trying to determine the outcomes associated with care that's being delivered and do that at a very broad and expansive way. The reason it's so important is that electronic health records that collect this information electronically, when paired with the research community that is able to analyze that data and determine the best ways to take care of patients, is really what we're striving for, to sort of develop this healthcare system that learns, or what we would call the learning health system.
Can we go into the technicalities with regard to extracting patient data for quality research?
Oh, sure. I mean, I think one of the things that's important, obviously, is that you have to have high quality data, but you also have to have it structured in ways with the right information or the metadata around it that allows you to know how to aggregate and use that information, to know whether it was an admission diagnosis or a discharge diagnosis. Those make a difference in how you interpret that information. So we've been working actually within the United States and actually across the international community to identify standards that can be used to capture that metadata. There's a standard that's in the international community called ISO 11179, and it's one of those standards that we believe is going to be helpful for us to be able to capture the information in a consistent way so that the work that we do in the United States is not just restricted to the United States, but in fact is compliant or is using standards that are available in the international community as well.
Now, Doug, what is the long-term perspective of all this with regard to healthcare in the U.S.?
Well, we're going through, over the course of the last couple of years, a dramatic change. I mean, we've really transformed a huge percentage of our gross national product from a paper-based system to one that's primarily based on electronic health records. And I think ultimately our goal is to get to the point at which every interaction that a patient or a doctor has with their healthcare system, or even with health, with their Fitbits and the other things that they have in their normal day-to-day life, that's something that can contribute to learning how to take care of that patient better and how to take care of patients like that better across the enterprise. So we are beginning on a journey. We've jump-started the process with meaningful use. We're expanding it with the work that we're doing with Pico and our ability to sort of integrate research. But we fundamentally believe that if we can take electronic health records and the clinical care that's delivered and marry it with the expertise of the research community to learn how to do things better, we can get to this learning health system in which we can really have all those pieces of data big and small, aggregated together to help us determine how to take care of patients better.
Doug, we're here at the annual Congress of the GMDS in Göttingen in Germany. What is going to be the topic of your talk here?
Well, I think you've sort of heard a little bit about what I want to talk about, and I think part of what is so exciting right now is that as we have all of this additional data previously captured in paper and now available in electronic format, we really have the opportunity to begin taking big data analytics and applying that to this area. Some of the data will be structured with the appropriate metadata. Some of it may not be structured. And it's going to take the communities, both the clinical communities who have the care problems and the patients they're trying to take care of, and the research community that has the analytic solutions to apply to those problems. I think bringing those two groups together, big data is part of big data as an extension, if you will, to some of the meaningful use, or as an opportunity to some of the work that's happened with meaningful use, is really, I think, what the next stage of our work should be.